It's a pleasure to be here, and this is a difficult first talk. I think this is one of the hardest talks I give because I hope you're engaged here because it's challenging and fascinating and very bewildering to me. And I have a take that might be different than what you've heard, but I'm trying to make sense of it all basically because there's just so many extreme views in this area. And I have to apologize, my brain is a little clouded from the foie gras I actually had last night, which ties into the lecture very nicely, but I happen to love foie gras. We're going to talk about all this stuff, and it's really, it'll be a whirlwind, but we're going to try to cover everything from obesity, metabolic syndrome, how it ties into fatty liver and NAFLD, where visceral fat fits in with that, and then go beyond fatty liver and try to figure out, is it NASH or fibrosis that matters? And I have an answer for you. And then also, are we really talking about liver risk to an individual patient or cardiovascular disease tied in with metabolic syndrome? And I think I have an answer for that too. But you know, take it with a grain of salt. This is my view. This is a multimodality talk because I can't pretend it's all about CT here, but I will have a CT focus throughout this talk. So let's just step back, and we all know the problem, the obesity epidemic. This is everything in sort of liver brown here is 25% or greater prevalence as of 2014. You can see essentially all of north part of North America, Australia, and then a fair amount through the Middle East and UK and so forth. And so this is, this is probably much browner now if we were to look at it. Things are getting fattier throughout the world. And this is even more sobering, I think, to see how cool blue we were back in the early 90s. We didn't have anything even close to 20% prevalence by state for obesity. By the time, it's starting to get dark blue, now there isn't a single state that's blue anymore. That is, every state in terms of obesity, and this is just by BMI measures, is now over 20%, and many are over 30% now. And I bet if we look, this is 2010, so I bet now there's a wave of darker brown here that's gonna, so this is continuing. We haven't seen I don't know if it's starting to plateau. At some point it almost has to, or there's only so many more people that can go that way. So just keep that in mind. It's a major issue, and I think we all know that. There are a lot of ways to measure obesity. Of course, BMI is the one that predominates, and just to remind you, that takes into account your weight and divides by the square of the height. You can look at abdominal circumference as well. That's also used as somewhat more specific, getting to that apple-pear thing. But I would just point out that none of these account really for the distribution. This tries to a little bit, but where you put your fat really matters. And